in Africa, especially here in Uganda, and they are pregnant, the support of a man physically escorting your wife to hospital, bringing her back, is that also part of the maternal health that we are speaking right now?
Absolutely. So they're partners. The husband and wife are partners. It's their baby. Both of them have provided genetics or material to form that baby. So the baby needs the love from both of them. And the love of the husband for his wife goes to the baby. So if the husband takes care of his wife, makes sure that she gets good nutrition, helps transport her to her visits, helps make sure that someone is there to watch her in case something happens, family member, respect her. There are changes in pregnancy that are difficult and hard to understand, and the husband needs to be patient. He needs to be kind. Men, you need to be kind and patient with your sweethearts, with your wives. That's exactly right.
Okay, away from that, now I want you to speak fibroids. I know we have limited time and I am making you touch on this, talk about this a few minutes, but at least our viewers are getting or picking something from whatever you're communicating. Fibroids, it has become a rampant case in women nowadays. I am very sure the days you have spent in the Busoga sub-region, you have gotten cases of fibroids, right?
Yes, yes. So what fibroids are, just so that people understand, the uterus, the baby house, is a muscle.
Okay.
It's a muscle. And a fibroid is a small tumor, not cancer, but a small tumor where one of the cells says...
A tumor is like a wound?
A growth. It's like a growth.
Okay.
And they grow and they get like the size of like an orange, or they can get the size of another, like all kinds of, they get bigger and bigger.
Like an avocado?
And and you can get many fibroids. And what happens is they can change the lining of the uterus. They can cause pain. They can cause abnormal bleeding. And they can prevent pregnancy. So fibroids can be a problem. And when I was this past week, the surgeons that I met with, Dr. Samuel and his team at the regional hospital, and
in
Dr.
Jinja?
In Jinja, and Dr. Pantheon in Uganda, really good surgeons. I was very impressed. We did fibroid surgeries. I watched them take out fibroids. The techniques they use are very similar to what I do.
To what you do?
I gave them a couple of pearls, a couple of ideas, but we had many surgeries, and I am very impressed with the healthcare surgical skills in the Busoga Kingdom. When His Royal Highness asked me to, he is so passionate about his people.
He is, yeah.
And when he asked Ari and I to come to identify how can they improve, because we can all improve. Even I can improve on everything. And so we spent this week going all over the kingdom. I needed to know what is happening in the rural areas, in the remote areas.
Not only in town.
Correct.
Okay.
And the midwives are so good. I watch them deliver babies. I watch the love that they have. They're overwhelmed. There's always more patients than there are providers.
Is big,
yes.
Yeah.
But there is a tremendous quality of care. Generally, I was very impressed with Dr. Samuel and Dr. Pontian and all of the people that work with him. But fibroids are very common. 30% of women have fibroids, meaning if you lined up 100 women, 30 of them will have fibroids. Most of them, it's not a problem. So fibroids need to be treated if they're large, if they're causing abnormal bleeding, or if a woman cannot get pregnant. Those are the three reasons. But just because they're fibroids, you don't take them out. Only if they're bleeding abnormally, pain, and infertility. Then they should have surgery.
Okay. When does one identify that they have fibroids?
So sometimes women can actually feel the uterus growing out of the pelvis. They can feel a mass above the pubic bone.
Okay.
Sometimes if their periods are very painful and are irregular.
Okay.
So normally the menstrual cycle, the bleeding comes once a month. If she has bleeding twice a month or longer periods, then one of the fibroids could be pushing on the lining and causing the bleeding.
The bleeding, yeah.
So abnormal bleeding, if the pain gets worse with pregnancy, with the menstrual cycle. Those are the reasons they should get checked. And then you can check on exam. A doctor or a midwife can identify them just on a pelvic exam.
Just by mere touching?
Just by mere touching, yes.
They can identify. But a medical doctor, right?
Yes.
So they need to go to hospital, just in case.
Just in case.
Especially if they have irregular periods,
yes.
Painful periods,
yes.
They should go and check out for
yes.
If someone finds out they have fibroids, what do they do? What do they have to do immediately? They get to know.
Fibroids take a long time to grow. So if they identify fibroids, it is not an emergency.
Okay.
It does not have to be, surgery does not need to be done today or
Tomorrow.
next week. I usually recommend if a woman wants to get pregnant and the fibroids are preventing her from getting pregnant, then she should have the surgery done and then heal and then get pregnant. If a woman is having really bad pain every month, more bleeding, then she should have the surgery. But just because they identify fibroids, don't rush the surgery because they can grow back.
Okay.
So if I treat a woman too soon before her pregnancy, take them out, and she waits a year or two, they may come back because they can.
Oh.
So treat them when they need to be treated at the time.
Okay. If a woman gets pregnant and they already have fibroid, can that woman have a normal birth, or it is usually a C-section and they remove the fibroid as well?
You got really good questions, Elaine. Very, very good. So if the fibroid is in the lower part of the uterus, meaning the head is above, the head can't come out. If the fibroids are at the top of the uterus, it is safe for a normal delivery. So it really depends. That's where you have to have an ultrasound. Only an ultrasound can tell you the position of the fibroids.
Okay.
But just because a woman has fibroids, she can carry a baby till term. We do not operate on fibroids
that
during
was going
pregnancy.
to be my next question.
Yeah, no women should not have fibroids removed when they're pregnant because it bleeds too much. And most pregnancies can do fine with fibroids. When I trained 35 years ago, fibroids, cut them out. And then women would bleed when they were pregnant. So then we said, no surgery for fibroids in pregnancy.
Okay.
Wait until labor. And then do an ultrasound. And if needs be, then you can do a cesarean section. But just because you have fibroids does not mean you have to have a cesarean section.
You can have a normal delivery.
You can have a normal delivery many times.
It doesn't guarantee you to
That's
have a
correct.
C-section.
That's correct.
Wow, that is good. Many people think fibroids are caused by the tablets that we take, especially family planning methods here that we use. Most people have that perception here. Is it true?
No, that's very sad. So family planning, the hormones actually decrease the ovaries' production of estrogen, and family planning can prevent fibroids from growing. So family planning does not cause fibroids to grow and will actually stop them from getting bigger.
What causes them to grow?
We don't know why they start growing. We think that the cells are changing and they just decide, they go. We don't know the actual reason why they start, but they're very common.
Okay.
But we do know they are what we call hormone dependent, which means the amount of hormones your ovaries are producing, particularly estrogen, cause them to grow. Family planning reduces the amount of estrogen in a woman's body and won't necessarily shrink them, but does prevent them from getting bigger. So if a woman is worried, then family planning can help.
Okay.
Yes.
Okay. We are with Dr. Tai. He's a specialist, especially when it comes to women issues. He is very good. That's why you see we are speaking fibroids right now. I know we have some viewers that have just joined in and they found us speaking about fibroids. So we need to keep reminding them we are with Dr. Tai. Dr. Tai is here on the invitation of the Chabazinga of Busoga. How lucky are we to have you on an invitation of our cultural leader? Okay, Dr. Tai, away from that, because we're about to finish, is there any campaign that you're running alongside the Chabazinga?
That's a really good question. So he asked us to come and analyze.
Okay.
So this main trip, I was training surgeons on advanced techniques. But the reason we went all over the kingdom is to gather data, interview people, and look at processes and systems. So Ari and I, over the next month or two, will analyze.
You're still here.
We're still here, but we
Wow,
will be
that's
leaving to
good.
go back to America. But when we get home, we will do an analysis, and then we will present to Dr. Samuel, Dr. Pontian, and the Ministry of Health, of course. We will present ideas of studies and things that can be done to decrease maternal mortality. Uganda has done a wonderful job in reducing mortality by 44%. It went from 336 to 180, roughly 188. That's 188 women per 100,000 who die. The lowest in the world is Iceland, 1. And the highest is your northern border. South Sudan has a death rate of 1,223,
That's too
whereas
much.
you're only 189. So Uganda and the Ministry of Health has done a good job. But there's more we can do. And Dr. Samuel and I and Ari, we were talking about really good ideas of what we can do, having changes of units and having specialized training. And it's not always about equipment. Everybody says, well, give me this, give me that.
Yeah, I
It's
know.
knowledge, it's knowledge. So we will help with a plan.
Okay.
Yes,
So that is what majorly you are here to do.
correct.
Okay. It is an honor, the Chabazinga of Busoga, that you have invited these your friends to come here and help us. Busoga, as a sub-region, we have challenges of young girls getting pregnant. Have you encountered these issues for the time you've been there?
I have.
And how have you tried to help?
We know that a girl's pelvis does not get big enough for a baby to fit until
true.
they are in their late teens. So a 13, 14, 15, 16-year-old
They're
girl,
still young.
they're young and their body is not ready for pregnancy.
Okay.
So they have a much higher death rate, a much higher uterine rupture, difficult delivery, fistula. Please let the girl finish developing. And that's not at age 12 or 13. It's not when their menstrual cycle starts. A lot of people think, well, she's having her menstrual cycle, she's having her
grown.
bleeding, she's grown, she's okay.
No, that's
no,
not
there's
true.
still growth, there's still growth. Please let the girls grow before they have babies.
Okay. Okay. I think the men in the Busoga sub-region, you have really heard what Dr. Tai has said. And even the Chabazinga of Busoga has been talking about this. He's actually encouraging the men in the Busoga sub-region, you have really heard. He's actually encouraging men to stand up and he has a, so I think even you adding a voice to his voice, maybe in Busoga we shall have a reduction in the early pregnancies that we have. Okay, as we are about to wind up, many women in Uganda, although you have said now we have at least reduced the number of death mortalities, there are so many women in different hospitals. You find a woman gives birth and the common excuse they give that the lady has been overbleeding. Women die. Babies die prematurely. What causes these sudden deaths immediately after giving birth?
So the most common reason for death is the uterus is really big with the baby inside, and there's a lot of good nutrients going to the baby. So we say there's a lot of blood flow to the uterus. When the baby comes out, the uterus has to shrink. If the uterus does not shrink, the woman will bleed to death. It's called postpartum hemorrhage. And so in the hospitals...
Is that the pain that we feel
immediately
after birth?
Yep, and the
uterus is
it's shrinking. And when it shrinks, the bleeding slows down.
Okay.
But if a woman has a birth at home and she doesn't have the medication that they give in the hospital, the medications that are often used, and I understand people give their friends nutrients and supplements, Don't use those supplements in pregnancy.
Okay.
Do not use supplements from your community in pregnancy. They have not been studied. They can cause problems. Some of them can even
Actually,
cause...
that is what I was going to. But I think, let me bring it here so that you explain more. You're actually, for you, let me say you're even sugarcoating it, calling it supplements. Here, we call them local herbs. So many women in our culture here, they believe those local herbs are much better than even the medicine we are given in hospitals. As a doctor, in your point of view, would you really recommend these people to use these local herbs?
I'm a doctor and I have studied lots of herbs. I think the safest and most important thing is do not use herbs in pregnancy.
Okay.
Because the plants and the substances have so many chemicals, and some of those can hurt the baby. So I implore you, please don't use supplements, or show the supplement to the doctor and see if they've analyzed it.
Okay.
I've seen so many complications from supplements being used in pregnancy, and I know people are trying to do good. I understand that, but I plead with you, please, if you have a supplement you're thinking of using, please go show it to Dr. Samuel or another doctor that can tell you is this safe or not. But right now, for your baby's sake, for your sake, please don't use the natural supplements. I don't care what the people say, they don't know. They want to be good, I understand. Your friends, your family, the local people.
People will keep recommending.
They want, but please don't use supplements in pregnancy unless you show it and talk to your doctor or your midwife, please.
Does it contribute to the deaths that we see?
It does. I know there are some herbs and supplements that are used, we identified them, that actually can cause the baby to die.
Wow.
Yes. Yes. And
Women, please listen to Dr. Tai. They should listen to you. Actually, I think you need to add a voice too. And maybe when they hear what you say, some of them will change. Tell those women in Busoga sub-region.
I know that I'm a doctor and I'm white and I don't live in your town, and I understand this. But I love you. And I understand your suffering and your pain. And I believe I am a credible voice. I don't have an agenda. I don't have a sponsor who's paying me money to do things. I'm here because of you.
You're even emotional.
And
it's okay.
Because I don't want to see women die. I don't want to see babies die.
I understand.
And please be safe and get good care.
Please listen to Dr. Tai. He has even become emotional. Me, who is here with him on set, I can really see it. I can really feel even when he's speaking. Please, he doesn't want to see any woman die. He doesn't want to see any baby die. I think that's a true definition of a doctor. In our culture here, we have traditional birth attendants. Have you heard of them?
Yes, I have. I have. Many cultures throughout the world have a traditional birth attendant.
Okay.
The problem is that the traditional birth attendant really has not had the correct experience on how to handle complicated deliveries. But also, one of the things we found out is that traditional birth attendants are charging money to deliver a woman at home. They will tell the woman to go for her prenatal care, but come and I will deliver your baby. And they are charging money.
Homes.
And we heard that. We know that's true. Now, not every traditional birth attendant is doing that, but that is one of the motivation, and that is dangerous. So I think a traditional birth attendant should help get the woman to the midwife, and if she wants to, listen and learn. But I don't think that women should be delivering babies at home by choice.
Okay.
Maybe she does it 2 times and things are fine, and she dies the 3rd time.
Actually, I've had one just recently. There's one who passed on from a traditional birth attendant's home because she was used. That was her 5th baby. She had delivered 4 babies from her home, and that was the 5th. So she thought everything was okay. And it was very unfortunate. The lady passed on. Fellow Ugandans, please go to hospital. Fellow mothers as well, please go to hospital. Attend your prenatal care, attend your antenatal care, deliver from hospital. It really, really touches to see a doctor like Dr. Tai becoming emotional because he doesn't want to see any woman losing her life, any baby losing her life. In 1 minute, Dr. Tai, please give us your last word and wish the people of Busoga a good day.
I have been so delighted to have been invited to come to the Busoga Kingdom, to visit the people, to see their smiles and their activity and their general happiness. I have been very blessed to learn from them, from the doctors and the midwives, and to train them. And I believe that great things will happen in the Busoga Kingdom.
Okay.
I think that good things are going to happen if we all try hard to help each other.
Okay. Okay, thank you so much, Dr. Tai. He has been here with us for almost an hour. Thank you for the very good words that you have really given us. Thank you for teaching us. I know we have learnt a lot. Personally, I have learnt a lot from him. And above all, we thank the Chabazinga of Busoga, His Royal Highness, Gavlana Diope. Thank you so much for being very insightful and having that keen eye and knowing that a mother in the Busoga sub-region needs people like Dr. Tai, and you invited them to come to Busoga. Thank you so much. Baba waife tukuendeza birungi byerere. Kale funvu wa Chabazinga lata ebyanda n'ebyanda.